Hello, my name is Csaba Kovesdy. I am a nephrologist, a professor of medicine, and I'm also the medical director of the Office of Clinical Research. And I'm here today to talk to you about what the Office of Clinical Research is. Uh, the Office of Clinical Research, or OCR, is an institutional resource that operates within the UTHSC Office of Research. And what OCR does, it provides various research-related services to UTHSC faculty who are participating or are interested in doing clinical research. Now, notwithstanding the name of OCR, which implies a broad coverage of various clinical research activities, the bulk of the activities of OCR consist of implementing clinical trials. So in order to make it clear what OCR's main function is and how any faculty member could utilize its services, I'd like to show you a brief infographic that will walk you through the different activities and possible contributions. So what you see here is a graph that illustrates how we go from a potential trial showing up on an investigator's radar to implementing that trial. As you can see here on the left side, it all starts with a PI, you, the faculty member, who finds out about a clinical trial that should be implemented or that you're interested in implementing at one of the UTHSC facilities. This trial could come through CTN2, which, as you might have noticed, is sending out periodic emails about potential new trials, or it could come directly from a sponsor to you, the PI, or you, the PI, could in fact come up with a clinical trial idea, for example, in the form of a grant that you'd like to implement. Now, assuming that you are a faculty member who does not have immediate access to your own clinical trial infrastructure, meaning a research coordinator or a trial office, you can consider reaching out to OCR, the Office of Clinical Research, for help with those procedures. What we would do at that point is sit down with you and discuss the particulars of the trial in order to determine whether we are eligible to conduct that trial here at UT or whether it's feasible or not to conduct the trial. In some cases, we may determine that the trial cannot be conducted because, for example, we may not have the patients, we may not have the facilities, and so on and so forth, in which case we would just notify you that unfortunately we cannot be of help. Having said that, in the majority of the cases, OCR will be able to provide services that are needed to implement a clinical trial. And what that means is that the next step is the administrative procedures that allow us to initiate a clinical trial. In this step, OCR personnel typically reaches out to either the OSP, the Office of Sponsored Projects, or to CTN2 to generate a contract with the sponsor. These contracting steps are taken up by these respective offices, and OCR coordinates with them. The other very important step here is to obtain an IRB approval for the clinical trial. And this is, again, something that OCR can facilitate and obtain for the trial. Now, one thing I didn't mention yet is that the services offered by OCR are a la carte, meaning that as a PI, you could reach out and request some or all of these services depending on your individual needs. Once the regulatory process is in place, and we also have a service agreement with a specific site where the clinical trial will be implemented, for example, Methodist or at Regional 1, then we can move on to the final stage and the most important stage, which is implementing the trial itself. This typically is done obviously with direct contribution from the principal investigator, but OCR can provide the research coordinator or coordinators that are needed and the regulatory personnel who will interface and liaise with the IRB for the various steps. And these, as you know, may include steps regarding study setup, the screening, pre-screening steps, enrollment of patients, implementing protocols, reporting the adverse events, severe adverse events, and then also the billing procedures, and finally the closeout. once the study is concluded. Now, if you have additional questions about OCR's activities, or if you are considering implementing or getting engaged with a clinical trial, I am showing you now the various contact information that we have on top with mine, and then the executive director, Dr. Risa Ramsey, who is responsible for most of the day-to-day operations in OCR. And finally, at the bottom, you see the link to our site on UTHSC main website.